to show you how to use your TURBOHALER. Firstly, you remove the lid. To load the dose, you turn that way and back again until it clicks. You take the inhaler to your mouth, breathe out, pop it in your mouth and do a seal around, and do a deep, forceful breath in. Holding the inhaler still in your mouth, you hold your breath for 10 seconds. Once you've counted to 10, remove the inhaler and breathe out. If you need to take 2 doses, you repeat the process again after 30 seconds. Do you want to try and have a go? If I pop that lid back on for you. Lovely. Turn it twice till it clicks. Into your mouth, deep forceful breath in and hold for 10 seconds. And breathe out. On the edge of the inhaler there's a counter. This shows you how many doses you've had and how many doses you've got left. When you get down to 30 doses, it's always a good idea to go to your GP to get a repeat prescription.
What I want to show you today is how to use this type of inhaler. It's called an Easy Breathe. That's one of the boxes of one of the preparations, how they come. Inside you've got a full instruction leaflet. It tells you in words how to use it, and it shows you pictorial how to use it. It's very, very useful. Before you do anything, even after I've showed you, please read it carefully. This is the inhaler. We give it a good shake. We open this. Before we use it, we have to exhale. We make a firm seal around the mouthpiece with our mouth. We breathe it in gently and deeply. We then hold our breath between 5 and 10 seconds. When you're holding the actual inhaler, you've got to make sure you don't cover up these air vents here, because that actually stops the propellant bringing the medication into you. So I'll exhale. That's 10 seconds, and now I'm done. If I want to repeat it, I'll just put it down 30 seconds and then repeat the whole process. Would you like now to try it, show me what you do, and let me watch you? That was perfect. Your fingers didn't cover the vents. You had a nice, deep, gentle inhalation. You held it for a good 10 seconds. For me, that was very good. If you are using 2 doses or 2 sprays of the inhaler, when you finish the first process, you wait 30 seconds and then repeat the process exactly the same. So you're starting shaking it again, you're doing the exhalation again, you're doing the whole process again. That's the way to have 2 doses. Depends what's been prescribed by your GP, you follow what's been prescribed.
I'm going to show you how to use your SPIRIVA HANDIHALER, okay? So inside the box, there's the inhaler device, the capsules which contain the drug, the powder that goes inside the device, and there's an instruction leaflet here which has got lots of diagrams that talk you through the stages that we're going to explain. So you can come back to that if you need to. Okay, so to use the HANDIHALER, first of all you need to open the lid. This here is the mouthpiece. The mouthpiece comes apart, and here's a hole where you put the capsule, okay? Just to show you, there's a green button here, and if you look, when you press the button across, some pins come out which pierce the capsule and allow the powder to be released, okay? So, we peel this back and take out a capsule. Capsule goes into the slot. Close the mouthpiece till it clicks. Push the green button in, and it's now ready to use. So just breathe out gently before you put it up to your mouth. Get a good seal with your lips around the mouthpiece, and then you need to inhale forcefully and deeply. Okay? When you finish the inhalation, I want you to hold your breath for a count of 10 seconds or as long as is comfortable.
Right.
Okay? Shall I just show you that then?
Yes, please.
So breathe out gently. And then just breathe out. You could hear the noise of the powder coming through, couldn't you?
That's right.
It might be a good idea to just repeat that breath afterwards, just to make sure you've got all of the powder through. So,
yeah.
okay, after that, open the mouthpiece, tip the capsule out, and you can have a look and make sure that all the powder's gone. And then you can just throw that away.
Yeah, right.
Close it up, and then it's ready to use again the next day.
All right.
Okay, do you want to have a go now?
Yes, please. Put the capsule in. Close it till it clicks. Breathe out.
Just need to pierce that capsule first, yeah?
Yes, yes.
That's it, brilliant. Breathe out, and then a forceful and deep breath in. That's brilliant. Now try and hold that breath for as long as you can, up to 10. Okay, great. And when you're ready, if you want to go and repeat that breath again.
I don't need to pierce it again.
You don't need to pierce it a second time. Okay, that's great. How did that feel?
Fine,
Okay.
fine. Yes, comfortable.
So you just took the capsule out, ready to throw that away.
Dispose of it.
Okay. It's ready to use again tomorrow. So it's used once a day, and it's best if you use it at the same time each day.
Right.
So most people would use it in the morning.
Right, understand that. Yeah.
Okay.
Yeah, that's fine.
I'm going to show you how to use the SPIRIVA RESPIMAT. In the box, it comes as a separate inhaler with a cartridge. For it to be used, it has to be set up, which I will show you how to do. You press the grey button to release the plastic cap, which comes off. Insert the cartridge to the bottom, which you have to press quite forcefully. Use like an armchair or a table till you hear it click in place, which means that the cartridge can't come out and it's firm. Replace the plastic cap back on until you hear the click, which means that the inhaler is now ready to use. Before you start to use it, you need to prime it, which involves the next few steps. You need to twist it till you hear the click. Release the cap and just point it towards the floor to release it. You continue this step until you see a white cloud forming. Let's do one more. There, you can see the cloud now produced. The inhaler is now ready to use. When you're ready, sit comfortably, release the cap and just take a breath out. When you're ready, make sure your lips form a seal around the mouthpiece, just making sure the air vents are kept free. Take a deep, gentle breath in as you're pressing it and hold your breath for about 10 seconds, or for as long as you feel comfortable. Then remove the mouthpiece, close the lid, and then reset it to take your second dose. So twist it till I hear the click, release the cap. That's okay? Yeah. Just to let you know, with the RESPIMAT, it does have a counter on the side which shows you how many doses are in the inhaler itself. When you get to the red bit, it means you have a week's supply left, so you will need to order your new inhaler. Okay. I'm going to show you how to use your metered dosing. It's an aerosol spray, so you need to shake it up every time before you use it. use it. Remove the cap. Before you put it up to your lips, just breathe out gently. Put it up to your mouth and seal with your lips around the mouthpiece. But to start to inhale, it's a gentle and deep breath in. As you start to inhale, push down to release the dose. Carry on with that breath, and then I want you to hold your breath for a count of 10 seconds or as long as is comfortable, and then take it away and breathe out normally. If you need another dose, wait for 30 seconds and process. Would you like to have a try now? Sure. So that's it. Remove the cap, shake it up. Okay. Breathe out. Get it up to your lips with a good seal around the mouthpiece, and just start to breathe in and push the dose down. That's it. It's a gentle and deep breath in. Now hold that for a count of 10 seconds or as long as you can.